Welcome back to the therapyleader.com Instagram and YouTube page. I'm Alan Zedeker, and I wanted to talk briefly today about a trait that early on in my career I really struggled to develop, but I found to be extremely important, especially in managing in the healthcare industry. And that is developing your EQ, or emotional intelligence. EQ stands for emotional quotient, which is different from IQ, which is your intelligence quotient. So, doing a lot of research and reading throughout my career and better developing this skill, I've come across 7 strategies for really honing this skill to be a better leader, a more present leader, and actively engaging your staff and understanding where they're coming from. The first step, I think that's extremely important in developing EQ, is self-reflection and self-awareness. You really want to understand your own feelings, your own emotions, and your own reasonings for making the decisions that you do. The second skill that you need to develop to improve your EQ is self-regulation and stress management. If you're not managing your stress well, you're not going to be able to really manage your employees' stress when times of stress appear during your work life. Number 3 is developing empathy and really actively listening to your clinicians and your employees as issues arise. If you're not hearing what their barriers are or their life stressors and personal stressors are, it's going to be hard to understand where they're coming from. The fourth step in developing EQ is developing your social skills and your communication skills. Some people have this already, but some people, like myself, really need to work on communication, social skills in order to better understand and better connect with your employees. Number 5, this kind of goes along with self-regulation, but managing your emotions during times of stress and properly expressing those emotions, whether it's verbally talking it out with your team or with your family, to really understand what you're feeling, why you're feeling it, and how to work past those feelings in order to be successful as a leader. Number 6, I think this is important in every aspect of being a leader, but especially for emotional intelligence, but continuous learning. Learning about generational differences in your employees, learning about the perspectives of their schooling. You may be managing different disciplines and different backgrounds and approaches to patient care, and I think it's important to know what they're learning in their programs so you can better address and help them. And number 7, sounds simple, but practicing compassion every day. This can be challenging when you have a department to staff. Somebody calls in, says they've had a death in the family, they're feeling ill, or they have a child that's ill. You need to staff your building or your agency, and you have patients to see. But in that moment, when your employee is going through a stressful time, you need to respect that the communication they're giving you is important to them and the reasoning is valid, and practice compassion in those moments. And that helps build trust. And maybe the next time that something comes up, they'll find a way to make it work and come to work and be a contributing member because they trust you and you respect their home life as well. So those are my 7 attributes of developing emotional intelligence. Again, something that I've worked really hard on, that I was not good at when I first started, but something that I think is extremely important to being a really good leader. Thank you. Have a great day.